So now what we will do is look at the last bone that makes up the bony anatomy of the shoulder. This is going to be the humerus. So if we add the humerus back in for a second, just so that you can see its orientation here. So remember, this is a left shoulder. For this review, we're only going to talk about the proximal end of the humerus. For the elbow, we will discuss the distal end of the humerus. The attachment or articulation between the humerus and the scapula, or the glenohumeral joint, is a ball and socket joint, but it's a relatively unstable one, which actually allows for all of the range of motion that we have. There's all sorts of different analogies. One of the more common ones is sort of like a basketball sitting on a golf tee. So you have the extremely large humeral head that sits on the relatively small and flattened glenoid fossa. So if we remove the scapula and just look at the humerus here. So the large friar tuck dome of the humerus, seen here. This, of course, is the head of the humerus, which is going to articulate with the glenoid fossa. Just lateral to that, you might be able to see the small sort of valley or indentation, and if I draw a line here to sort of outline it, that rings around that head of the humerus. This is going to be known as the anatomical neck. This is not to be confused with the surgical neck of the humerus, which would be found down here. The surgical neck is so named mostly because when you get fractures of the humerus, they're likely to occur at that surgical neck, which would require surgery. As we are looking at the anterior aspect of the humerus, you will notice two other bony prominences on the proximal humerus. These are going to be our lesser tuberosity, and then a little bit more laterally oriented, the larger, greater tuberosity. These two bony landmarks are, of course, important because of their role in being an insertion for our rotator cuff muscles. So the greater tuberosity of the humerus is going to serve as the attachment for 3 out of the 4 rotator cuff or sits muscles, and then the lesser tuberosity is going to serve as the attachment for our 4th sit muscle. Running in between those two, sitting a little bit more laterally than most people give it credit for, is a valley between those two tuberosities or tubercles. And this is known as the intertubercular groove or sulcus. The other more common name is the bicipital groove. This, of course, is going to be where we see the short head of the biceps running up to the supraglenoid tubercle. Lastly, about midway down the shaft of the humerus on the lateral aspect, you might be able to see, if you follow the contour of this humerus down, you notice that it takes a little bit of a bow here. I sort of overemphasize that. But right at this point here, about midway down the shaft of the humerus, this is the deltoid tuberosity. This is obviously where the deltoid muscle, or muscles, if you want to count them as 3 separate muscles, would attach distally.